We tell the truth. We say that we have an expensive system, as we do, and it only produces average results. And once we get that straight as a starting point, we can have an intelligent discussion. But if we fall victim to the political rhetoric that we have the best healthcare system in the world, then people will say, hey, we got a great system that's terrific, leads the world, why have a discussion about it? Well, it's easy to blame the media. I mean, the media, I suppose, has some degree of responsibility, but it's really civic society. It's groups like Ivey sort of saying to people, look, these are the facts internationally, these are the facts in terms of domestic costs, etc. And very much political actors. They know that we have a system that underperforms, but they're very afraid to say it in public. So if you get civic society and you do get the media and you get political actors all saying, you know, folks, we really have to pull up our socks here and do better because our system is very costly and we're not getting the results that we need for that spending, then we can have a discussion. People who advocate, and correctly, that there are many things we should do to try to make the population healthier, and there are a certain number of public policies that you can do to try to help people get healthier, I don't disagree with that. I simply warn people that there are certain limitations on what the state can do. For example, I was mentioning the fact that the average television set is on in a Canadian house 23 hours a week. There's not much the state can do about that. In fact, there's nothing the state can do. The largest number of our citizens now live in areas that the census defines as suburbs. They're very spread out, they're very car-oriented, they're not friendly for people who want to go walking or go to the corner store on their feet. So how does one get around that? Then there are these deep income inequalities, and income inequalities lead to poor healthcare outcomes, which means more pressure on the system. Dealing with income inequalities is a tough, tough debate, bigger than some of these narrower debates about public health care. So I was simply saying, yes, let's focus on prevention. Yes, let's pay more attention to public health. There's lots of things we can do, but don't exaggerate what public health can do. Well, when Roy Romano in 2002 did his report, he said that we needed to spend a lot more money to buy change in the healthcare system. And the Premier's then Prime Minister Paul Martin accepted that recommendation, and they decided to spend $41 billion additional dollars over 10 years. And predictably, the doctors and the nurses, who were the best organized and the best motivated, grabbed a disproportionate amount of that money. And we didn't really buy change, we bought peace, and we bought time. Because if there were challenges and problems, there was always more money to throw at it. There's never enough money, but there was more. Now, all the governments are in deficit. They were in surplus at that time. So even if you wanted to do a Romano and throw billions and billions of additional dollars at the system, you'd have to borrow the money. It's not there right now. And we don't want to go borrow the money. So necessity is often the mother of invention. And as a consequence, you're going to get people who have to use their craniums now to find more innovative ways of doing things because they won't be able to go get money to throw at these problems. So I think there'll be more innovation in the system in the next 5, 6, 7 years than there was in the last 5, 6, 7 years. And that's no bad thing.